3 effective ways to get pregnant fast. Unless there are underlying causes of infertility, these 3 tips can help you conceive within 1 to 3 months. Tip number 1. Know your ovulation days and communicate with your partner. First, let's discuss the role of ovulation in fertility. Ovulation is when an egg is released from the ovary, and this is the prime time for conception. Understanding your ovulation cycle and utilizing it is the best way to get pregnant intentionally. There are various methods to track ovulation, such as ovulation predictor kits, basal body temperature tracking, and monitoring cervical mucus. However, the best way to ensure you don't miss your ovulation period is to count your menstrual cycle days and set aside at least 3 days when ovulation should occur. Here's how to do this. For a 28-day menstrual cycle, which is the most common, ovulation usually occurs around the midpoint of the cycle, typically on the 14th day. Therefore, mark the 13th, 14th, and 15th days as your most fertile period. For women with longer menstrual cycles, ranging from 29 to 35 days, ovulation typically occurs 14 days before menstruation. As you count down to the end of your cycle, the 15th, 14th, and 13th days before menstruation become your most fertile period. For women with shorter cycles, from 21 to 27 days, the 14th day before the end of your menstrual cycle is your ovulation day. Once you have identified your ovulation days and your most fertile period, the next most important step is communication with your partner. Communicate with your partner. Open communication with your partner is key. Share your ovulation tracking results and discuss your fertile days with him. This can help reduce stress and ensure that both partners are on the same page, making the journey to pregnancy a team effort. As a woman, you need to understand that conceiving is not something you can do alone. You need to be in sync with your partner. This communication can also help him prepare and concentrate his energy during your fertile period. Busy or traveling partners can make plans to be present during your most fertile days. To conclude this first point, identifying your ovulation period and optimizing it by working with your partner, remember to avoid having a lot of untargeted intercourse. Tip number 2, correct hormonal imbalance. What is hormonal imbalance? Hormonal imbalance occurs when there's too much or too little of certain hormones in the body. This can disrupt various bodily functions, including reproductive health. For women, conditions like polycystic ovary syndrome and anovulation are common culprits. Men can also experience hormonal issues, such as low testosterone levels. How does it affect fertility? Hormones play a vital role in regulating the menstrual cycle and ovulation in women, as well as sperm production in men. An imbalance can lead to irregular periods, disrupting the entire menstrual cycle and making it difficult to track ovulation, or affecting sperm quality and quantity. This can make conception challenging for couples. Hormonal imbalances can seriously influence a woman's fertility journey, often creating challenges that might go unnoticed until they accumulate. Understanding the signs of these imbalances is very important for anyone trying to conceive. Here are some indicators that may suggest a hormonal imbalance is at play. 1. Irregular menstrual cycles. When periods become inconsistent, whether too long, too short, or completely absent, it could signal underlying issues with ovulation. These irregularities are often tied to hormonal fluctuations, and women may also experience heavy bleeding or unusually light periods, both of which can be red flags. 2. Anovulation. This means the absence of ovulation. If a woman isn't ovulating regularly, She may not be producing adequate amounts of essential hormones like FSH, LH, or progesterone, all of which are crucial for the timely release of an egg. Without ovulation, conception becomes significantly more challenging. 3. Severe PMS or PMDD. While many women experience some premenstrual discomfort, intense mood swings, severe bloating, or very painful cramping that exceeds the norm may indicate a more severe hormonal disruption. These symptoms often come from imbalances in estrogen and progesterone, highlighting the delicate interplay of hormones in the menstrual cycle. 4. Chronic fatigue. Experiencing extreme tiredness, even after a full night's sleep, can be linked to thyroid hormone imbalances. The thyroid plays a vital role in regulating not only metabolism, but also reproductive health, and any disruption can leave a woman feeling drained and affect her fertility. 5. Unexplained weight changes. Sudden weight gain or loss without any changes in diet or exercise can be concerning. Fluctuations in hormones like insulin and thyroid hormones may be at fault, and these changes can directly impact ovulation and overall fertility. 6. Acne or oily skin. Adult acne, particularly when accompanied by unusually oily skin, can be a telling sign of hormonal imbalances, especially elevated levels of androgens. Conditions like polycystic ovary syndrome (PCOS) frequently manifest through these symptoms and are a common contributor to infertility. 7. Hair loss or excess hair growth hirsutism. Unwanted hair growth on areas like the face, chest, or back, alongside thinning hair on the scalp, can indicate elevated androgen levels, often associated with PCOS. These signs reflect how hormonal imbalances can manifest both internally and externally. 8. Low libido. A noticeable decrease in sexual desire can point to hormonal issues, particularly involving testosterone, estrogen, or progesterone. These hormones are all integral to a healthy reproductive system, and imbalances can significantly affect libido. 9. Breast tenderness. Experiencing breast pain or notable changes in breast tissue can suggest hormonal imbalances, especially if there's an excess of estrogen. This symptom can be part of a broader pattern of hormonal disruption. 10. Hot flashes or night sweats. These symptoms are often associated with hormonal fluctuations, particularly during perimenopause. While they are more common in older women, any significant hormonal shifts can potentially affect fertility at various life stages. If a woman finds herself experiencing multiple symptoms from this list, it may be wise to consult with a healthcare provider for hormonal testing. Identifying any underlying issues can be the first step towards addressing potential fertility challenges. Understanding these signs empowers women to take proactive steps in their reproductive health. Tip number 3. Treat every suspected infection. One of the major causes of infertility or delay in conception in women is untreated, unmanaged or badly treated infections. Infections can significantly impact fertility in women by causing inflammation, scarring, or changes in the reproductive organs. But many women do not take it seriously to seek medical attention immediately when they have symptoms of these infections. Here are some ways infections can affect fertility. 1. Pelvic inflammatory disease, PID. This is a serious infection of the reproductive organs, often caused by sexually transmitted infections, STIs, such as chlamydia and gonorrhea. PID can lead to scarring of the fallopian tubes, which may cause blockages and increase the risk of ectopic pregnancy. 2. Endometriosis. Chronic infections can contribute to the development of endometriosis, a condition where tissue similar to the lining of the uterus grows outside it. This can lead to pain and fertility issues. 3. Uterine infections. Infections in the uterus, such as endometritis, can interfere with implantation of the embryo and disrupt hormonal balance, impacting fertility. 4. Cervical infections. Infections like human papillomavirus (HPV) can affect the cervix and may lead to changes that interfere with sperm passage or increase the risk of miscarriage. 5. Ovarian infections. Infections affecting the ovaries can disrupt ovulation and hormone production, leading to fertility issues. So, as you plan to conceive soon, it is important to take note of any symptoms that may indicate the presence of an infection and quickly and thoroughly clear them. Here's a list of common symptoms that may indicate such infections. 1. Pelvic pain. Discomfort or pain in the lower abdomen, which may indicate pelvic inflammatory disease (PID. 2. Abnormal vaginal discharge. Changes in color, consistency, or odor of vaginal discharge can signal infections like bacterial vaginosis or sexually transmitted infections. 3. Odor. A strong, unpleasant odor from the vaginal area can indicate an infection. 4. Painful intercourse. Discomfort or pain during sexual activity may be a sign of an underlying infection. 5. Irregular menstrual cycles. Changes in menstrual regularity or heavy bleeding can indicate hormonal imbalances due to infections. 6. Fever. A low-grade fever may accompany infections and indicates the body's response to infection. 7. Fatigue. General tiredness or fatigue can be a symptom of infection. 8. Burning sensation while urinating. This can indicate a urinary tract infection (UTI), which may affect fertility. 9. Nausea or vomiting. These symptoms can occur with severe infections. 10. Lower back pain. Pain in the lower back can be associated with reproductive tract infections. 11. Swollen lymph nodes, particularly in the groin or abdomen, indicating a systemic infection. If experiencing any of these symptoms, it's important to consult a healthcare provider for proper diagnosis and treatment. Early detection and management of infections can help preserve fertility. In conclusion, here are the 3 key tips. 1. Track your ovulation and take advantage of your most fertile period. 2. Identify and address any hormonal imbalances. 3. Treat all suspected infections promptly. Even if several of these issues are present, timely medical intervention should typically resolve them within 2 to 3 months, allowing for conception. Remember to work closely with your partner. It's important for him to be aware of your ovulation and most fertile days to align efforts. Take note. Men can also have hormonal imbalances that impact fertility, so both partners should be proactive in managing health. Additionally, when treating infections, it's crucial to ensure both partners receive treatment to avoid reinfection and ensure successful results.
We hope these tips help you on your journey to parenthood. Remember, every journey is unique, so be patient and kind to yourself. If you have any questions or want to share your experiences, drop a comment below. Follow Pink Word Matters for more videos on women's health. Subscribe to our YouTube channel Pink Word Matters and select the bell button for notification on our next video. Don't forget to like and share this video. See you in the next video.